So, hi, everybody. Welcome to Luke's Legacy Research Rounds. So, this is an initiative brought on by the folks in the logos below. So, that's Kids Brain Health Network, Can Child Center for Childhood Disability, Childhood Disability Research, McMaster University, and Family Engagement in Research Training Program. So this is an extension actually of their family engagement and research training. So this event was created actually as a tribute to my son, Luke Martins, who passed away last August, 2020. And its purpose is essentially to put relevant research in the hands of families, which is where this information essentially belongs. My son was someone who essentially lived his life with a deeply felt set of values that in things like connection, collaboration, and trust, and things like that. And he had a way of kind of naturally assuming that he had a seat at the table. And the environment in research is slowly changing to a point where families are starting to get more of a seat at the table and being partners and things like that. And we're trying to find new ways to move information forward and to make some of the science really a lot more accessible to families as well too, because I mean, who doesn't like a good sleep at the end of the day? So in this session, we really hope that these values are threaded through the conversations that we aim to have with you as the research community, the parenting community that we aim to support as well too. And if we can go to the next slide.
I don't think there was any other slides
Oh,
except for
my
this
bad.
one.
That's
Yeah,
all good. Well, I'll just
sorry.
got one more little bit to say, and then I'll be right. Then it's all yours, the floor. So I'd like to take a moment to thank our hosts, which is, as I mentioned, Can Child Center for Childhood Disability Research, Kids Brain Health Network, and Luke's Legacy Research Rounds, an extension of their collaborative program, the Family Engagement and Research course. This course aims to bring families together with researchers to learn more about partnering together in effectively producing new kinds of research. And so I'm just going to introduce you to Dr. Penny Corkum, who is a part of the Better Nights, Better Days program, and I'll give you the floor.
Thank you. Excellent. Well, thank you for the invite to present to this group, and it's really exciting. I think the initiative that you're leading here to have this nice synergy between the people who are ultimately going to use the research and the people who are generating the research and working at increasing collaboration. So it's really exciting initiative and exciting to be part of it. So thank you for the invite. I thought I'd just start by telling you a little bit about me, and then I was going to ask a little bit about the audience. And so I'm a child clinical and school psychologist. So what does that mean? It means that I'm interested in, I guess, interested in issues that kind of cut across the clinical domain and school. So I'm really interested in trying to support children's learning, their behavior, their attention, and sleep is one way to really enhance children's performance and to help them cope better in their day-to-day functioning. So that's how sleep sort of comes into the puzzle for me. I do work as a clinician, so I started 20 years ago a clinic, which is an ADHD clinic, but it's really a differential diagnostic clinic. So we see kids who have attention problems, and our job is to figure out why they have attention problems. And you can imagine there's so many reasons. So only 50% of the children that we see actually are diagnosed with ADHD, and the other 50% have mostly other neurodevelopmental disorders like autism, spectrum disorder, or learning disabilities. So it's a really exciting initiative, and it's a partnership between the school board and mental health. And so I think it's one of the few partnerships like that exists. So it's an exciting place to work and lead. And then I'm also, I guess my primary job is a professor at Dalhousie University. And in that role, I teach undergraduate as well as PhD clinical psychology students. So I teach these students about neurodevelopmental disorders and mental health disorders in children, how to do assessments, how to do intervention. And I myself have been studying in this area for a long time. So I'm getting older, I guess we all are every day. So I've been doing this since 1986. So at first it was more focused on ADHD and more of the cognitive or basic kind of mechanisms around ADHD and why they have the problem, why children with ADHD have the challenges that they do. And then I went to a fabulous talk just before I started my PhD about sleep, and I realized that the relationship between the two. And then in my work, I was running a medication trial for children with ADHD, and I saw how their sleep was impacted and how this affected their day-to-day functioning, but also the family's functioning. And so that's what got me interested in sleep. And that's really what I've been researching for quite a long time now. And then I always, like probably many other people on this line, I have multiple roles and wear multiple hats. So I'm also a mother. He is now a young adult, but I've had that experience, and he had or has a neurodevelopmental disorder. So have had to navigate that as a mother as well. So it's been interesting being on both sides of the table at times. I also get the opportunity to train lots of students, and I think that that's a great way to keep learning. They challenge you and bring new ideas forward, so it keeps you young in mind at least. And so that's been exciting for me. And so I do wear multiple hats, and I think that right from the beginning as a psychologist, I really believe in that synergy between science and practice. So I've always tried to have my my practice working with families, interacting with families, inform my research, and then use my research to support families. So that's kind of been my approach for my research career. So I thought it'd be good maybe just to step back and see who's here. So I just have a little poll just to get numbers of how many people are parents or teachers, health professionals, researchers, trainees, advocates. And I appreciate that, like me, you probably have multiple roles. So I hope that you can select all that apply. So if people want to just take a second and complete that poll, and we'll see who's with us today. Maybe we'll just like 30 seconds. Okay, I think that's probably long enough. So I think there. So 59% is the majority is health professionals. Now you can wear multiple hats, so it may not actually count, add up to the total number in the room, but parents, researchers, trainees, advocates, and teachers. So a nice variety. So welcome everybody, and I'm really glad that you can join me today. And I'm hoping that I can share a bit about my research and what I've been doing, but also hear from you about what it is that you think is important for me to consider in my research role. So we'll just close that, and I'll move to the next slide, hopefully. Yeah, so I told you a little bit about kind of my philosophy of research, but my research lab is called Labs for Learning, Attention, Behavior, and Sleep. And I really kind of think of this as I have two really broad research areas. So one is around school mental health, and I have a really cool, I think it's a cool program called Assist, and it's a professional development online e-learning program for teachers, helping them to understand children with neurodevelopmental disorders and to be able to meet their needs better in the classroom. And I'm actually doing a large implementation study with that right now. And so, but I'm not going to talk about that because I'm going to focus on sleep. And then the other area is sleep, and kind of the intervention that I've been most focused on is Better Nights, Better Days. And that's what I'll talk more about today. But like I said earlier, these two go together. So children who have neurodevelopmental disorders have more sleep difficulties, and then those sleep problems have a bigger impact on their day-to-day functioning. So, and if we can improve sleep, we can improve some of that day-to-day functioning. So the two are really interrelated. And when I think of my research, while most of my efforts these days is more on intervention, developing interventions, evaluating interventions, and what's really new to me is sustaining interventions, thinking about how can they live beyond my grant funding. And this was sort of with my assist program. It was, you know, I created what I thought was a great program. Teachers really loved it. They said that it was really helpful. And then when the funding ran out, it just sat in my research lab. So it really drove me to start thinking about different ways of getting these programs out there and self-sustaining so that they can actually continue to grow and be updated and be current. So that's where most of my time is spent these days. But over my 20-year career as a researcher or more, I've also tried to look at the mechanisms or understanding underlying problems, and also spend quite a bit of my research time thinking about assessment, because I think I'm a big advocate of assessment. I think we have to really know what the challenges are, strengths and challenges, in order to really have a good intervention. I can't stress enough how dedicated I am to that view. I don't like the move where I think what's underfoot right now is we're just screening people very quickly and putting them into an intervention. And I think sometimes we don't get the right intervention because of that. I really think we have to do more comprehensive assessments. So, so I do some research in that area. And like I said, I am going to talk about my sleep research for this particular talk. And I thought I would just share briefly some of the types of research that we've been doing in terms of understanding and assessment, and then focus most of my time this evening on the intervention side of the research. So in terms of understanding research, I've done quite a few studies that I've actually found really fun to do. So there's sleep manipulation studies, so manipulating children's sleep to see how it impacts their day-to-day functioning. And this little guy was one of our participants. Obviously his mother gave permission for the picture to be shown. And so, you know, why am I interested in this? I guess taking a quick step back. Oh, hopefully you didn't see that. We should put up poll 2. I was going too fast. So first of all, I want you to guess or make an educated guess at what percentage of children who are neurotypical versus children who have a neurodevelopmental disorder, what percentage have sleep problems or sleep disorders. So it's just a quick multiple choice. Pick one that you think is best representative of that question. So the first percentage is for neurotypical children, and the second percentage is for children with a neurodevelopmental disorder. Okay, so if I think we could probably show the results. Doesn't take too long to fill that in. Okay, either we have a extremely knowledgeable crowd or you saw my slides. I'm not sure, but that's okay. Yes, you're right, 30% and 85%. So this is a pretty highly prevalent problem, with 30% of typically developing or neurotypical children having a sleep disorder. Mostly the disorder that would be the most common is insomnia, which is just difficulties falling asleep, staying asleep, and waking too early. It has to be persistent, chronic, and frequent to meet criteria. And 85% of children with neurodevelopmental disorders will meet criteria for a sleep disorder, again, mostly insomnia. And we know through lots of correlational research that poor sleep is related to poor daytime functioning. Now, the problem with most of the research out there, in my opinion, is that it's correlational. So we know these go together, but we don't know that they're causal. Is sleep problems really causing poor daytime functioning, or is it something else maybe that's causing both? So we really don't have a good handle on that. So that's where I've spent a lot of my research time in the last decade, trying to manipulate the sleep to see, can we actually identify in a causal way, can we say that changing sleep actually changes daytime functioning, and how does it change it? So I thought I'd just share again very briefly, because we don't have a ton of time, 3 studies. It's actually 4, but I have them kind of grouped together in 3. So the first study was done about 5 or so years ago. And what we did is we had children who were typically developing, and we restricted their sleep. So they had to sleep 1 less hour per night for 4 nights. And then in the other condition, they had to sleep they had to go to bed 1 hour earlier for 4 nights. So you can't make someone sleep without drugs, but we don't do that. So all we can do is really restrict the time they're in bed or increase the time they're in bed. And this resulted in a 1 hour difference. And this was randomized. So some kids had the restricted time first, followed by the extension, and vice versa for some of the other kids. And then we measured their sleep using actigraphy, which is just like a fancy Fitbit, a more of a medical grade Fitbit. So it measures sleep by movement is really the algorithm. So if you're quiet and still, and there's certain other features, it's going to mark that as sleep. So we knew these children were sleeping about an hour difference between the 2 conditions. And what we found was really, I thought, really interesting. With just this really short 4-day sleep restriction, only an hour a night, we were able to document really quite significant changes in daytime functioning on objective measures. So not just on someone telling us, but actually seeing it. So they had more difficulty regulating their motion, more difficulty with short-term and working memory, poorer executive function. They were making more academic mistakes. So on math tests, they were, not following maybe the signs. And one of the ones that I was really intrigued by was that they had less positive affect. So if you showed nice pictures of like puppy dogs and ice cream and that sort of thing, in the sleep extension condition, they were quite happy. They reported these pictures made them feel happy. But in the sleep restricted conditions, their mood was a little lower. They weren't as joyful about these pictures. So, and again, this was just a short sleep restriction, but we were seeing these pretty big impacts on daytime functioning. These were all neurotypical, typically developing children. And you have to kind of wonder, I mean, if it changes their daytime functioning like this, what would it do for a child who already struggled in these areas? So that's what we try to do with the next study. And again, we manipulated sleep in the same way, except for this time it was for 7 nights. And we actually compared it to their typical sleep, because in the first study, we weren't sure if the difference was because they were actually getting better sleep or worse sleep. So we wanted to control for that in the second study. Something happened that I didn't anticipate, and in a way was a bit of a downer, because these studies take like years to do. I had to bring them into the sleep lab for 20 hours each time. Like, they're very intensive studies. The kids compensated for the sleep restriction, which I thought was fascinating. So just over 7 days, they started falling asleep quicker, and they started sleeping more soundly. They weren't waking up at night to catch up for that sleep, which I thought was really interesting. But what was even more interesting was that the children with ADHD had more difficulty doing that. So the neurotypical kids were able to compensate for the sleep restriction or the sleep disruption, where the children with ADHD had more difficulty. So I think that speaks to some of the sleep challenges that these children may have. And then the last 2 studies, actually, I just kind of combined them in one here, was looking at the impact of stimulant medication, which is used to treat ADHD symptomatology, so attention problems. And this was during a blinded medication trial. These children were all medication naive. They've never had stimulant medication before. They were newly diagnosed with ADHD through a rigorous process. And what we found was that, in fact, as you would expect, you had the behavioral improvements. So attention was better, less impulsivity, less restlessness, but their sleep was more disrupted. So they were taking longer to fall asleep. They actually slept an hour less per night. So if you think back to that first study, what happened with 1 hour less per night, and this is happening in medication. And it also changed their sleep stages. So they went into deeper sleep quicker and stayed in that to try to compensate, I think, for the sleep restriction. We also found that the sleep prior to the medication trial impacted the effectiveness of the medication as well as insomnia symptoms. So I just think there was a lot of things we learned here, but particularly for me, the take-home messages were that sleep causes, it's not just correlation, it causes some daytime functioning problems, and that this may be a bit different for children who have neurodevelopmental problems like children with ADHD compared to a neurotypical or typically developing children. So that kind of just gives you a bit of flavor of kind of how we've been looking at understanding sleep problems in children. The next area that we do research on is around assessment, and I told you that already, and maybe we'll just do the quick poll for that. Assessment, really important, at least from my perspective. So how much time do you think a health professional gets in training about pediatric sleep? This is cutting across all professions, so medicine, nursing, psychology, occupational therapy, social work, all across all the health professionals. So maybe we could show them now, the answers. Yeah, you are very educated group here. You're right, 0 to 30 minutes. So not much time is spent about sleep, assessing sleep, treating sleep, why there's sleep problems. And if you ask about learning around children with neurodevelopmental disorders and sleep, really very little time spent on that in curriculum in terms of the health profession. So they don't necessarily have a lot of training in this area, which is a limiting factor for sure. Okay, so in terms of the type of work that we've done with assessment, first I'll just kind of tell you generally the assessment tools for sleep are outlined here. So I have them organized sort of from the most subjective, if you will, to the most objective. And you know, so history and interviews tend to be more open-ended, you know, used in clinical practice. Same with questionnaires. Sleep diaries, so having a parent or older child actually fill them in nightly in order to get a sense of where some of the challenges are. Actigraphy, I told you about already, kind of like a fancy Fitbit or motion tracker, and then polysomnography, where you have EEG, you have respiratory, you have lots of different physiological recordings happening in order to actually measure sleep. So you can look at the brain and what stage of sleep you're in and get a deeper understanding. But of course, it's very intensive and very time consuming and quite invasive. While she has a big smile on her face, I did, I think, about 250 of these. And, you know, it's not easy for the kids to have multiple leads all over their body. I mean, there's probably like 30 wires coming from them and to sleep like that. So, you know, from a research perspective or a clinical perspective, we're not going to be using that very often. And so often we'll use actigraphy in research as a good way to estimate sleep, or we'll use sleep diaries more in clinical practice. So I was curious about how do these measures hold up for children and also for children with neurodevelopmental disorders? And I won't spend a lot of time going over the details of the research, but the real take-home message is that some of the screening tools that are being used are actually not that good, and they're going to miss a lot of kids with sleep problems. Also, while some of these, you know, we often compare to the gold standard, which is polysomnography. And when we look at the comparison, like say actigraphy to polysomnography in typically developing children, it's pretty good. Actigraphy is a good estimate. What I found really interesting was that for children with ADHD, it actually wasn't. And we use it a lot in ADHD research. It wasn't as good as for typically developing kids. And why is that? Well, children with ADHD move a lot more. And so this affects the algorithm that we use. So again, really important information when we want to assess children, but also when we want to evaluate outcomes like from interventions. And then we also looked at differences between ADHD and typically developing children on polysomnography. And this is some research I've done over a number of years and through different projects. And what I've been finding consistently is that when children with ADHD, when they don't have any comorbidities, so they don't have like anxiety or other mental health disorders or other neurodevelopmental disorders, and they're not on medication, we actually don't see a lot of differences in their sleep in terms of sleep stages and kind of the sleep physiology. But more recently, one of my PhD students just last year found that there actually may be some differences at a deeper level in terms of stability of sleep. So they may be more likely to be awoken during the night. So it's not that their sleep is all that much different from physiological perspective, like in terms of sleep stages. You know, they have the same amount of REM as a typically developing child, same amount of non-REM, but they actually may have less stability of sleep, which is really an important concept in terms of getting good quality sleep. So these are some of the kinds of questions that we've been asking about sleep measurement. And then moving on to, I guess, more of the topic for today is the treatment part. So what percentage, this is another poll, what percentage of children with sleep problems receive evidence-based intervention? 15, 25, 35, or 45%? Okay, so let's see what the answers are. Yes, you guys are so good. Yes, 15%, so not very many. That's sort of why we're really interested in developing these interventions. So we know sleep problems are really prevalent. We know they have this big impact on daytime functioning, but there are actually very few interventions that are evidence-based, so evidence to practice gap, but there's also limited access to the intervention, so a treatment gap. So when I say evidence-based intervention, I'm talking right now about insomnia. This would be what we consider evidence-based. First, providing psychoeducation to parents, teaching them about sleep, implementing healthy sleep practices like reducing screen use, you know, making sure children get enough activity during the day, making sure they're not drinking caffeinated drinks close to bedtime, make sure they're not watching screens close to bedtime. Then we might move, if this doesn't work, we might move into more specific sleep interventions, more behavioral interventions, and then medication would be kind of the last step in this stepped approach. Unfortunately, if I had the computer savvies, I'd make this twirl around and go upside down, because what actually happens that a lot of kids get medication before they get the other interventions that we know can work. So what excites me about working in this area is that we actually, you know, we have a problem. It has a, you know, it's quite often a problem for kids. It has a big impact, and we actually know how to help kids, and that's really a cool thing. We just have to get it out there. And so one of the ways is to use eHealth, or to, you know, do it through the internet. And I was doing this before there was a pandemic. Now we're all doing it, but, you know, definitely delivering it this way can bridge that gap. It can make it accessible, and we can scale it up pretty quickly. It can be quite efficient, can be quite cost effective. So we developed a program called Better Nights, Better Days, and this was originally funded by CIHR, and it was for parents of typically developing children. And the team kind of brought with them some already evidence-based interventions. So I had one for school-age children, Graham Reed had one for preschool children, and Shelley Weiss had one for infants and toddlers. So our plan was, we're going to take our interventions, we're going to put it with the larger body of research and develop the content, and then we're going to pair this with what people, you know about evidence-informed delivery of eHealth, and we're going to do this all in 6 months. This was not the reality of my life. This was more of it. It was a big roller coaster. We had many challenges, and it did take 6 years rather than 6 months. So it was a very big learning curve for me. And it turns out you just don't take something in print and put it on the internet. It doesn't work that way. It really is quite an involved process. So, but in the end, I think we created a really cool intervention that we've shown to be effective. So it's responsive design, which just means that you can access it through like a computer or a tablet or a cell phone. It's in 5 sessions. So if you think of that triangle I talked about earlier, it basically follows that, except for not the medication piece. So it's using psychoeducation, behavioral interventions. It is self-guided, so there is no coach, but we have a coach in the program. So this is Ashley, and she walks the families through the intervention. She's both a real person as well as a cartoon person. Most of the content is delivered through animated videos, but some of it's through expert kind of videos. There are ways of tailoring it depending on the child's age or problem. There's also tracking, so goal setting, and then tracking those goals across the week. There's interactive pieces, so you can build a routine, a bedtime routine, or a reward chart for a child. You can track the child's sleep, and that's graphs, so you can see if you're making good progress. And then there's session plans that you follow. You can download information. And the last piece is called roadblocks. And so this is where a parent would go if they were having some difficulties with implementation. And so we did conduct a randomized control trial. So basically we asked parents to join us. Half the parents got the intervention up front, and then the other half went on a wait list, if you will, and then they got it at the end of the 8-month period. And we wanted to see whether the program improved children's sleep and whether it improved the daytime functioning or psychosocial outcomes. And we recruited 533 families from across Canada, English and French version. And we had really good outcomes. They're just in the process of writing it up to publish it. But basically, the children's sleep improved based on the parent report, but also on actigraphy. Daytime functioning was reported to be better, both in terms of quality of life and behavior. Parents provided high satisfaction rates, and we saw some persistence of the improvement across time to the 8-month period. And then lots of nice feedback. I just picked these ones. Obviously, I'm cherry picking a little, but by and large, it was really positive. So, parents thought it worked, but also they really liked that it was very step by step and that it could be individualized and there was options. I think that parents really wanted those options. And I know this is about family engagement, and just to tell you kind of how we engaged families in developing this is that we actually had them doing versions of it prior to and giving us feedback. So it was really developed with input from parents throughout. Then we thought, well, what about children with neurodevelopmental disorders? And we were really fortunate for Kids Brain Health Network to fund a modification. And so how we did this modification is we conducted a number of studies. So first we went and looked in the literature. What do we know about sleep in kids with neurodevelopmental disorders? We did a Delphi study where we asked experts in the area who were treating sleep problems in kids with neurodevelopmental disorders what they thought needed to be included. Then we ran focus groups with parents and also frontline healthcare providers that would recommend these interventions, got their opinion about what worked, what didn't work, what would need to be there. And then we had parents do the intervention and give us feedback. Then we took all this information, we modified it into what we call a transdiagnostic modification. So we started with that original core, and then we added on cross-diagnostic modifications. So for example, a lot of the parents told us that it takes up more time for a child with neurodevelopmental disorders to learn some of these strategies. So we increased the time that parents had access to the program. We made symptom-specific modifications. So for example, anxiety might be something that cuts across most disorders and can impact sleep. So we added pieces to that program. And then we added in diagnostic specific modifications. So for example, for our cerebral palsy group, some strategies around pain and sleep. We are currently conducting a randomized control trial with this. We have completed as of February 8th, so not very long ago, all the recruitment, and now families are just working their way through the intervention, and we're hoping to have all of that completed by the winter time, so November 2021. Then my story's almost over, but then we thought about the pandemic. We were sort of ahead of the curve in terms of everything was already online. We already knew how to deliver this in a very scalable, accessible way. And so, we knew that from research that was coming out that the pandemic was really impacting sleep in a negative way for many families. Sometimes it improves sleep for some families, but most it makes it more challenging. And so we didn't have a lot of research at the time about what about families in Canada. And so we went back to our Better Nights, Better Days participants, both the parents of typically developing children as well as the parents of children with neurodevelopmental disorders. And we did a survey and interviews with them. And we found the parents were reporting that 40% of the children were worse after the pandemic or during and after. Their sleep was worse than beforehand. And what we were really struck by was that 60% of parents were saying that their sleep was worse. So it was having an impact on the children, but even more so on the parent. And through the interview, we really got the sense of this back and forth and bi-directional influences. So if the parent was stressed, it affect their sleep, which would affect the child's sleep, and vice versa. So we really had to think of the family, not just the child. We had to think about the child within the family. We also found that the sleeping for the worse was associated with getting less exercise, having more screen time, and increased anxiety. And what I was really pleased to hear that 95% of our respondents said that they thought other families would benefit from Better Nights, Better Days during the pandemic. So with this information, we were able to apply for CIHR funding, which we were successful with. And it has allowed us to modify the Better Nights, Better Days program. So we've added in a pre-session about COVID-19, how it impacts sleep, why it's important to work on sleep and improve sleep during times of stress, and what that can do in terms of resiliency and improving kind of daytime functioning. It also allowed us to enhance that 24-hour perspective, so I think instead of seeing sleep and wake as different, one impacts the other. So really seeing it from a 24-hour perspective. If we don't sleep well, then we don't have good days. If we have bad days, we don't sleep well. So we need to see the interaction between these. And we also decided to add in tips for parents' sleep, just given how important it was, this bi-directional relationship between parent sleep and child sleep and stress as well. And so we were able to do that. And we just literally, yesterday or 2 days ago now, we launched our implementation study with a goal of recruiting 1,000 parents of children ages 1 to 10. And our goal for this, like what we want to accomplish or what we want to find out, is whether this program improves sleep and mental health and well-being in families during the pandemic. And we also want to look at implementation. So how can we get this program out to families? And so we're comparing two different approaches. One is a more, I think, novel way through like more marketing approach, a direct to consumer marketing approach, and the other is a more traditional knowledge user pathway, and that is being led by the Canadian Sleep Society. So that's kind of where we're at. So we have 3 months to recruit 1,000 families, and we'll see how we do. But we've really tried to streamline the research piece. Sometimes that can be quite a burden to a family. So we've really reduced the amount of questions that we're asking, and hopefully that will help parents be able to participate. So just to give you some other ideas about some other interventions. So you can see we've taken Better Nights, Better Days, and we modified it for children, parents of children with neurodevelopmental disorders. We also modified it for parents of children who have OSA or obstructive sleep apnea, who their OSA has been treated, but they still have residual insomnia. So we have a program for that. We have a program for youth and young adults, which I think is really cool. It's called micro units. So it's like short, quick learning about sleep. It's bite-sized information. It's a totally different model than our other Better Nights, Better Days, but it's really neat. So we've been building that with the youth. So we have focus groups, we bring them in, the design, and then they try it out. So again, really try and engage the end user. And then we've been developing an app called the ABCs of Sleeping. So it's I think it's pretty cool. So it's an app, and you do like a little assessment, and then it gives you tips about how to help your child sleep better. We did a usability study, so we got parents' feedback on that for children, and we're right now doing one for parents of younger children, so 6 to 12 months of age, so for babies. And I just thought I'd bring your attention. We wrote, the Better Nights, Better Days team wrote this assessment and treatment of pediatric behavioral sleep disorders in Canada. So it's sort of a Canadian perspective on the assessment and treatment of sleep problems and some of the challenges and some of the strengths we have in terms of addressing these. And so if you're interested in this topic, it's a good paper that will kind of cover all pieces of that. And then just, I'm going to wrap up, and I just wanted to give a few acknowledgements. So obviously, all this research can't be done without funding. So we're always very grateful to our funders, the Kids Brain Health Network and CIHR, Health Research Nova Scotia. Its name has changed, but that was the name when we got the funding. The IWK Health Center in Dalhousie, and then of course my trainees and staff. And I have a few of them highlighted. So on the top, first one here, I don't know if you can see my pointer or not, but that's Sydney Dale McGrath, and she's project manager, and she manages the lab and the projects. Dr. Elizabeth Keys, who was my postdoctoral fellow, is really taking a lead on the COVID sleep study. She's now just started a position at UBC, so so she'll be leaving our lab, but she's going to continue to collaborate. And then Esmat Begum, who is my research associate and does all the data stuff. And there's lots of others that contribute at the bottom. Third one in is Kim Tam McNeil. She ran most of the neurodevelopmental foundational research studies. So everybody definitely contributes a lot. And then, of course, the research team, and these are clinical scientists from across Canada focused on pediatric sleep. On the left is the typically developing version team, and the right is the neurodevelopmental disorder version team. And then, of course, all the families that have participated at every stage. And I hope that when I was preparing this talk, I wasn't sure about how much to go into that, but I'm happy to talk more about it. But we really do try to make it a back and forth so that we're meeting the needs of families. I mean, clearly, if you want an intervention that's going to be effective and be able to be used by families, you need to have input so that you know what that's going to look like. So we've been very fortunate to have had lots of family involvement. And so we do have a little bit of time left, about 17 minutes, 18 minutes, I think. And so this, I think I was supposed to leave time for questions, but I thought I would plant a few questions. I would really love to know from all of you, like, what do you see as the priorities in terms of sleep research? And I list it kind of in terms, you can't actually fill in this poll because I wanted to have like an open text box, but that doesn't work with this type of polling. But, what do you see as some of the critical questions around understanding sleep problems and sleep in children? What about the measurement or assessment of sleep, and then the treatment of sleep? So I'd love to hear your thoughts, but I'd also be really open to answering any questions you might have about the information I presented.
Thank you so much for this, Penny. This was a fantastic presentation. Oh, wow. 100% treating sleep problems.
Okay, there you go.
That's the emphatic direction from the group today.
Yeah. That's yeah, there's no middle ground there. It was 100%.
Oh, I don't think I've actually ever seen that on a Zoom survey. So I'm quite impressed. A point of interest, I think, too, when it comes to the treating sleep problems, I can say that from my own experience as a mom, my sleep issues were quite rare, dramatic, and very unusual. And one of the people from your team, Dr. Hanlon Dearman, was actually my physician at the time, was the only person who gave us the time of day. And I can actually say, because of our rare sleep issues, she's literally the person who helped contribute to buying our son a lot more years with us.
Oh, wow.
The sleep issue. So next time you see her, tell her I said, hey, and
I will. No, we have an amazing team. And, I think what they all of them are clinical researchers, clinicians. So they're hearing from parents, working with parents. So when they come to the table to develop like a research project, it's like parents are in their head telling them all the things they want, and they need, right? So it's not just a pure research, it's really that synergy between clinical work and research. So, and
Absolutely. And I
yeah,
think the reason I brought that up too was this is in some ways there's a lot of new science, but this is a practice for many that is consistent and ongoing for many years as we continue to try to figure all of this out. Now
yeah.
we do have one question here from Kate, who is asking, are you still accepting families in the 1,000 needed? If so, how does one get involved?
Yeah, we just started the other day, so we're a long way off 1,000. But yes, so we love to have any families. If you just go to our betternightsbetterdays.ca, and it will tell you all the information. Thank you. Someone put it up there. You can watch videos about the program, you can read about it, and then if you're interested, there's a want to participate button, and you can pursue it that way.
For sure. And Kate mentions here as well too, does the program touch on hyperactivity?
Yeah,
Mhm.
that's a good question. So the neurodevelopmental, the NDD version that we are now closed, and we had ran a randomized control trial, and we finished recruitment for that. It does. So when we think of those layers, like I think of it like an onion, we kind of layered on different strategies for some of the challenges that unique challenges that the kids would have. So we definitely address that there, but the COVID version is our typically developing version. So it's not designed specifically for children with neurodevelopmental disorders. Having said that, many of the strategies, if you think of that model, like that core is the same. And so I think that you would get some benefit from it, but maybe not as much as you would from the NDD version, but we're not in a position to open that one up yet. So next time.
For sure. So a few more questions here. Any general sleep tips, like a really fun takeaway, either for parents or for kids, or both, really?
Yeah. Yeah. So let's think. I mean, probably, I guess the other piece is there's not a lot of rocket science here. It's really good, healthy sleep practices. And it's like learning any new skill. You have to practice it. You have to be consistent with it to make it work. And I think, for children who have neurodevelopmental disorders, it's that much harder to do that. And I definitely appreciate that challenge. And especially there's a lot of other stressors, so it can make it even more challenging. I developed this mnemonic called the ABCs of sleeping. And so maybe I'll just walk you through that, because that's kind of like the foundation of good sleep. So ABC stands for age appropriate bedtimes, wake times, and napping with consistency. So kids have to have the opportunity to get the right amount of sleep, and it has to be consistent. So when I say consistent, I mean between weekdays and weekends, no more than a half-hour difference. Think of it like going to France and back. Not that we're allowed to fly anymore, but it's like jet lag. So if you're, on Sunday through Thursday, you're going to bed at 9 a.m. or 9 p.m., sorry, or 8 p.m. But on Friday and Saturday night, you go to bed at 10, then you have to basically make up that jet lag. So it's really hard. So consistency is really key there. So that's ABCs. Sleeping, so schedules and routines, really important. Sometimes, like a chart of the schedule may sound silly, but it keeps everybody, not just the child, but it also keeps us as parents following the routine, because that could be hard to do sometimes. Location's really important. So you do need a room that's dark and quiet, cool, not too hot, not noisy, no cat jumping on you in the middle of the night, no hamster running in a wheel all night long. So you have to think about, not cluttered, not a place that is anxiety provoking. So, maybe you don't want to be doing homework or having any negative associations with your bed. So making it a place for sleep. We're on location. Electronics, this is the big one. and this is what has happened in the pandemic, is that we're using electronics so much more, and it's really impacting everybody's sleep. So the rule of thumb is at least an hour before bed, having no screens whatsoever. That's really important. Why is that? Well, electronics give a blue light, and that affects our melatonin, and it means that it won't be released, which means that we can't fall asleep. So it's really important. But also they can be stimulating or arousing, and you can get worked up, and then you have to be calm to fall asleep. Exercise and diet. So you do, the Canadian Participation, I love, they put out this thing that said, are our kids too tired to exercise, or not, too alert to sleep, right? So like how they impact each other is just so important, and not having a lot of exercise close to bedtime because it can get you wound up. But in morning time, bright light and movement to wake you up, and it also helps set your system. P stands for positivity, so making the bedtime routine positive. We have to be calm and relaxed. I don't know about all of you, but I think many parents find that the time our kids want to tell us all the bad things of the day is just like when they get to bed, they're finally like calm enough to tell you, and it's like then it gets them all worked up. So having a time earlier in the day for that. Independence when falling asleep. This is a tough one. More and more kids are co-sleeping. Thing is that how you fall asleep, we all have these little micro arousals all night, and we expect everything to be the same. This is like back from our cave days. So if you fall asleep with a parent or a sibling, an hour later, 90 minutes later, when you have this little micro arousal, you're not even aware of it. You're checking your surrounding, and if it's different, you wake up. And so this is why it's not because it's like bad. It's just because then it's going to become a brief arousal. It will become like a full waking, and then it's hard to get back to sleep. So you have to be independent. All your needs have to be met during the day, obviously. And if you follow all these, like that's kind of the second rung, like have all that in place. You can do that on your own. And then some of the more behavioral strategies like, fade at bedtime, or, doing some changing the lighting and working backwards and that sort of thing probably require a little more input from a healthcare provider. But you can do all those healthy sleep practices on your own. And again, I think for families of children with neurodevelopmental disorders, the challenge is doing it consistently because of all the other stressors. I don't know if that helped, or was that too fast?
No,
I covered a lot of them.
A lot of great tools there.
Okay.
There's a lot of really, some detailed about Better Nights, Better Days. Some of them, will the intervention be free as it gets rolled out to families, was one big question. There was another one as well too about resources for schools and encouraging, from an education standpoint, the benefits of sleep as well.
Great question. You know what I forgot to put on there? I actually was really fortunate. I got this funding from the Australian government, lucky me, and I got to go to Australia and work with sleep researchers there. We developed a program called Healthy Sleep for Healthy Schools. And so it's a curriculum for teachers to use with their students to teach them how to be better sleepers and what makes for healthy sleep. So we're testing that out now, and it's going quite well. So definitely have working on that. I think it's so important. Yeah. And that was another really big learning moment for me. My son was in a band and the lights went out at a practice, or I guess it was a concert or something, and they were in the dark, and percent of the high school students in the band fell asleep within 20 minutes on the stage. Once you took all the excitement away and the lights, and they're all exhausted, they're all sleeping up there. And it really made me realize, how important it is for kids to be sleeping well for school as well, right? Not just at home, but for them to be able to function at school. So I think it's really important to have these programs. The research right now shows that these health promotion programs for sleep in schools don't they translate into better knowledge, but not necessarily better sleep. And so we're trying to work at ways to actually get it to the next step, which is improving the kids' sleep. And how we've done that is we've paired like the teacher curriculum with a program for the kids, Better Nights, Better Days Youth, and so that they're actually implementing the strategies at home. And so hopefully that will make a difference in their sleep.
Excellent. And the program was free. Am I correct with the?
Yeah, so right now it is free, and as so these 1,000 families, it's definitely free. And as I mentioned before, we're kind of looking at different models of sustainability. So how do you sustain this over time? Because it does cost money, right? It costs money to put it on the web. It costs money to have tech support. It costs money to update the technology. And so we're looking at different ways of doing that. I mean, you can imagine like a health system purchasing it and doing that, or selling it direct to the consumer, to the parent. So, and one of the questions, that we're going to ask these 1,000 parents is like, what do you think? How should we do this? Like, what would you be willing to pay for this? Could you pay for it? What would be reasonable? That sort of thing. So we're exploring.
That's a fair assessment. I think that's a lot of the challenges with new ideas and rolling them out. Where does it fit in an already complex world?
Absolutely. And, even I know sometimes like Johnson and Johnson picked up a sleep program for infants, and they're kind of funding it in the States. So, maybe there's a bigger company that would pick it up. I don't know. I just know that research funding can't pay for it forever, right? So somehow we got to figure this out. So that's one of the big questions I'm going to be asking parents is, any ideas, what would work, that sort of thing.
And some of the other questions that came out here as well were things like, does it affect people from, like, does it go into detail things like medical conditions like restless leg syndrome, people with reverse sleep cycles, things like that? Does that connect?
Yeah. So the program is really focused on more than insomnia, difficulties falling asleep, staying asleep, waking too early. However, we know that some of the problems like restless legs, for example, or circadian difficulties, getting good sleep actually can really help those too. I mean, it's not going to solve them, but it can help them. And then there is some information about these other sleep disorders and suggestions of where you can get more information, who you should speak to, some, questions about those. I mean, those are things that would have to be addressed outside of the program, but I think healthy sleep is always helpful.
Absolutely. Some of the other questions here, is there a way for professionals to access the program as well?
Not at the time, because we're in the middle of a research study. I mean, I think it's a really good question. One of the questions I have kind of moving ahead is, as I mentioned, this is a self-guided program, so parents have to guide themselves through the program. And I think for the majority of families, that works. I think it's really clearly laid out. It's organized well. There's supports in the program. But for some families, it's not going to be enough. I mean, there's never going to be one program that works for everybody. And so one of my thoughts is, could a health professional work with a family using this program? So like a family probably already at the outset knows that they need more support than just what this could provide, and maybe they could work with a health professional through the program and do a session, come back, talk to the health professional. The health professional might help them problem solve any difficulties they're having, giving them extra support. So maybe there's a study coming up about that. I think that would be really interesting.
Mm-hmm. And I think access, I think, is a big challenge coming down the pipeline as well too. With a lot of this, I think that's one thing I come across with a lot of families is where to even begin to look for services and things like that. Even polysomnography for some people are out of touch, but I think that putting something like this in the hands of people who can self-guide, at least it's a start to a very complicated conversation. That's for sure.
Yeah, and definitely there's a lot of variability in access to health, to sleep intervention and sleep support. So for example, in Atlantic Canada, we do not have a pediatric sleep lab, period. So any child who needs a polysomnography, or, you know, they have, you know, complicated medical conditions with maybe some structural differences that might be affecting the child's sleep, they either don't get it or they have to travel to another province. And I remember working with this one family, and it was a mom of a child with autism. And I mean, the child had never been on a plane, had never been away from home, and had to go to Toronto to a big hospital to get a polysomnography. And there was no funding for both parents to go, only one parent. Like, just the challenges that were faced by that family to get there. And they did it, and he couldn't settle for the procedure, so they never got it. You know, at least if it was in your community, you could go back another weekend, right? Like, or adjust. So there's huge disparity in terms of access to different types of intervention and assessments. You know, some provinces have behavioral sleep clinics. So like children who have more like insomnia or difficulties falling asleep, they might be able to get resources. Other provinces don't have that. So yeah, it's very difficult. And the more complex challenges, harder to find healthcare providers that can support those families.
Absolutely. I remember our first sleep study 12 years ago. The clinician told us that if we got 4 hours, we'd be good.
That'd be good.
And what that ended up being essentially was me waiting for a ride home at about 3 a.m. In inner city Winnipeg, just roaming around the hospital grounds. My son was happy as a clam, like, I'm free, no wires on me, and just doing his thing. We got the data though, so that was great. But I wanted to take an opportunity to thank you for doing this today with us, Penny. And for anybody who is interested in asking more questions, we have the Better Nights, Better Days website. It's an easy Google. We also do have, they're available on Twitter as well as Facebook. I know on Facebook, I'm not sure if they're still on there, but I know there was some great
yeah, there is
Facebook Live webinars on there as well too that were a really great resource. So do check that out. So we're so glad that you guys could join us, and I wanted to take a moment to remind you as well too that these rounds are an extension of the Family Engagement Research course. And if you'd like to learn more about it, either as a researcher or as a parent, please connect with us at the email on the slide there as well too. So thank you so much everyone for joining, and we look forward to having you next month as well too, which we'll be talking about siblings. So that'll be a really great conversation as well.
So thank you for the invite. And if you have any questions, people on the line, you can reach out to us. Go to Facebook, you can message us or what have you. We're happy to answer any questions about the program.
Thanks everyone. Have a great night.
Bye.
Bye.